Medicaid asset protection isn't just a good idea, it's essential for middle-class families. Your mother can spend over $100,000 in 1 year on nursing home care. Without attention, all of her assets could be gone. I'm Kellen Bryant, Florida Bar Board certified elder law attorney, and in this video, I'm going to explain and break down the real numbers, the common mistakes, and exactly what you can do right now to protect assets. Let's get started. All right, first, let's look at the costs. Let's go into your search engine and type in carescout.com. You can do it at the top if you like as well. You click on CareScout or go into carescout.com, and you're going to find, get in my head, a menu called Cost of Care. Click on that. Now, go ahead and click and type in your location. 32256 is mine, and click on it, and it zooms us in. And so the cost of care in Jacksonville as of 2023 is for a semi-private nursing home room is $11,700 a month, or annually $140,000. In different parts of Florida, it's going to be less because of the rural areas, and in other parts of Florida where there's not enough nursing homes for the population growth, or it's just much denser locality like in Miami, it may even go higher. If you're looking at long-term care insurance as well, this will give you an idea of how much it costs per hour for in-home care, $29. How much it costs a month for assisted living, about $5,400, $5,300 as well. And then annually, $64,000 for assisted living, and private room nursing home care is $146,000. So first, when you see these costs, you think to yourself, is this legit? Because we're all used to, at this point, seeing that a little tablet of aspirin from the hospital charges is $30 to $60. Or we see hospital charges that are just a flat, give us all this huge amount of money. Long-term care is not a form of health insurance cost. It's a different type of cost, and it's not covered by your health insurance, only limited Medicare coverage for long-term care. And these numbers are legit because the facility has to hire a lot of staff to meet a lot of people's needs and pay a lot of staff according to market wages. If you Google and research the rate for private duty or certified nurse assistants, say CNAs and nurses, their compensation is getting higher and higher because there's fewer and fewer people able to, and willing to do the job. So over the course of time, if somebody needs long-term care in a nursing home, their assets are going to be spent at a clip of, in Jacksonville, $140,000 a month. So easily it's $100,000 in most of Florida. And so when you are facing these costs and concerned about these costs and you're private paying for these costs, you say, is there a way to slow this down? And that's Medicaid. Medicaid slows down the cost of long-term care. And the first question I usually get is, if we're getting Medicaid to pay for the facility, we're going to get bad care. Under federal law, if somebody is in a nursing home paid by their own funds or private pay funds, the nursing home cannot discriminate between those two patients. So what does that mean? You're going to get the same care if you are private paying or getting Medicaid paying and helping pay. Next, if you say those Medicaid facilities are nasty or disgusting, look at the facility type, because most nursing homes licensed as a skilled nursing home accept Medicaid. So if you look at any short-term rehabilitation in nursing home, you look them up and look about the forms of payment. If they're taking Medicare, they're going to also take Medicaid and have Medicaid beds in most circumstances. Now, the only exception are the big buy-in facilities, that the continuing care retirement communities. They may not accept Medicaid directly into their facility because they have a large buy-in to move first, and that's their business model. The second mistake on saying nursing home Medicaid or Medicaid facilities are scary is confusing nursing homes with assisted livings. Now, assisted livings, I would estimate, maybe take half or less Medicaid, as you'll find. If I'm an assisted living and looking for assisted living, I would expect that they don't take Medicaid, but they have lesser form of care at assisted living than in a nursing home. Usually the nice assisted livings will not accept Medicaid, and that's how they are run in their business model. They're looking for high-paying assisted living residents that will pay their costs over time. So how does Medicaid work? And in Medicaid, what they do is, if somebody is Medicaid eligible, Medicaid will pay the difference between your income, your loved one's income, and the cost of care. So if instead of saying it's $100,000 or $140,000 a month or a year, we're starting at $140,000, and every month your parents' income is going to be paid to the nursing home, and without Medicaid, a portion of their assets is also going to be paid to the nursing home. So let's break that down. If you do not have Medicaid coverage and your income is $3,000 a month and the nursing home private pay bill is $12,000 a month, you will be spending down your assets at a rate of $9,000 per month. And the big mistake is not paying attention to this Medicaid stuff that I'm talking about, because you can just sit back and not realize that there's other things you can do to protect assets rather than spending it down to zero at a rate of $9,000 per month. Or a lot of people think on a mistake is I have to spend everything down on nursing home care before applying for Medicaid. And that's not true. There are rules in Florida and federally that protect from total and complete nursing home spend down. So the people who, when you talk around town and talk to your friends and they say, yeah, you got to spend all the nursing home. One, the first question is, why do you say that? Did you actually experience it, or is it continued word of mouth hearsay? Okay. Two, did you ever talk to an attorney? And if they said, yeah, I talked to an attorney and attorney wanted all kinds of money. If the attorney wants a lot of money, it's because it's a lot of work and a lot of value to you. Because if I had to pay 1 month of nursing home bill, private pay, it's $12,000 to hire an attorney, and I see that my mom could live 6, 12, 18, 24 months in a nursing home, paying the legal fees once to get all this extra savings makes sense to me. So understanding that once you become Medicaid eligible, there is what's called on the Medicaid rules, patient liability. And so essentially all your gross income must go to the nursing home. And then Medicaid in Florida's Agency for Healthcare Administration, they'll pay the difference, Medicaid reimbursement rate to the nursing home. And so that the nursing home will have a little bit of your income and money from the government to then pay their bills and keep revenue and keep operations. So that's the patient liability key term. Now, in the interplay of what you do and what's going on here is the 5-year look back rule. I have other videos explaining spin down strategies and the look back and transfer, what all that means on this channel. So under the 5-year look back period rule, generally you can't give away your money today to get on Medicaid tomorrow. Of course, that's unethical and not allowed. So pre-planning and crisis planning is terminology we use as elder law attorneys in relation to this 5-year look back rule. So 5-year look back period means that when you apply for Medicaid, you can't give away your money within 5 years. So pre-planning cases are when people say, hey, I got more than 5 years, or you know what, I have so much assets where, even if I did get placed in a nursing home within the next 5 years, I still have to wait 5 years. And so crisis planning cases that we talk about in law firms and most practitioners in this area is, I need Medicaid now. And so there's different sets of rules and different sets of instructions depending on the situation and how much time you have. So if you're working with anybody, they need to take that consideration about prognosis. So if you say, my mom she's in hospice, they're saying she may have weeks, she's not eating. Does it make sense to Medicaid plan? No, you shouldn't hire a professional to protect assets if we had a crystal ball and knew how long your parent would be with us. So what happens if you don't plan? One of my classic examples that I see come into this office if you don't plan is a family seeing mom start to decline, and they look at assisted livings and they find the nice assisted living facility and they say, let's have mom go there. And I say, yeah, that makes a lot of sense. And then they say, since mom's at this facility, she doesn't need this house that she's at. So let's just go ahead and sell the house. And so that turns the protected homestead into unprotected cash. And so mom will go ahead and live her life at that assisted living facility, and the family will pay from her assets, all logical. However, they haven't planned for the contingency if the assisted living can no longer meet her needs, and all assisted livings can no longer meet her needs, and she still has $100,000, $180,000, or even $400,000 left. And so that's when the situation converts into a crisis plan. And here we are sitting with lots of money and a mom who can no longer live in assisted living because her needs are so much, but she's not going to pass away. She just requires a load of care. And so after the family has liquidated everything, put everything in one bucket because it's easier to manage, they potentially expose all these assets to nursing home costs and jeopardize Medicaid eligibility. So what happens is they say, I don't want to deal with attorneys. I don't want to pay with attorneys. So I'm just going to continue to pay the nursing home $12,000 a month. But then to add insult to injury, they see that the mom's roommate is getting Medicaid, not paying $12,000 a month. And they see their roommate getting the same quality of care and saying, hey, what gives? I'm paying all this money and I'm not getting anything good and good quality of care. And so with Medicaid planning, all the rules are designed so that if all the money is gone, you can have a pool of money over here. And I'm speaking at it generically, big picture. You have a pool of money over here, legally transferred, legally allowed to be transferred, that you can use to enhance your mom's quality of care. And so with that pool of money over here, you can have somebody visit your mom daily to do that TLC, to make sure that the TV's changed. She's getting taken outside. She's getting her laundry done and not mixed up with the general population. She's getting her needs attended to. She's getting advocacy. She's getting there's little things that just make somebody's life better. She wants to go out to a restaurant. There's money there to transport her to go out to a restaurant and be with her family, despite needing a lot of care in some cases. So if you don't plan ahead, you don't get that enhanced quality care and dignity and quality of life if all the money's run down to zero. Because if all the money's run down to zero and you're taking care of your parent, how likely are you to say, okay, let me go in my savings because I'm really guilty about how mom's being taken care of, or let me start taking off a lot of work to make sure my mom is being taken care of. With mom's own money, you could have money set aside to do all these things rather than spending it down to zero and trying to ask for siblings to help pay you back. Now, in the case of a married couple, the problems are the spouse who's not needing nursing home care is saying, I need something to live on. I'm seeing all this money and get spent each month on nursing home care, and I may just run out of money and I'm gonna be living on ramen noodles in Section 8 housing, and I don't like that. And we saved and worked all of our life, and this is where I can find myself. There's rules to protect spouses in that situation. And the last thing is when you run down to $300,000 down to zero, what I hear is at times that my mom, she clipped coupons, worked full-time for 42 years, worked hard, gave us everything we needed, and now I'm spending $12,000. All these things she deprived herself on the nursing and paying the nursing and the home's bills. And this person over here who didn't save, who didn't work hard, is also getting Medicaid coverage, and they can get the same type of care. No planning puts you in those situations. So what happens? What can you do? What happens if you do plan? Like I mentioned earlier, if you plan ahead, you'll have money over here that will allow your loved one to have an enhanced quality of life. Is it a magic wand? If you're crisis planning, is it a magic wand? Your mom has $120,000 and you move it over here and there's no consequence? Of course not. The Medicaid rules do provide trade-offs on each action, and some options may be of that 120, ultimately what's kept and protected for mom may be 60% of that money, but that's better than zero. Or you can choose a different action and it could protect 95% of that money. It just depends on the options and trade-offs that you're willing to do to protect assets for your mother and your mother's goals. Now, the big thing that I always get, and I've already seen comments about on my videos, is this is a scam, you're gaming the system, and this is unethical. Let me give you a little history lesson, and you can decide whether or not, if you're facing the situation, whether or not where you fall in your thinking. So originally, the root of all this is in the Great Society, back in the 60s, Medicaid was created, and it did not cover skilled nursing. Medicare did not cover skilled nursing care, but Medicaid did. And under Medicaid programs in our Great Society, it said, hey, if you're out of money, we'll pay for your nursing home care. But before that, people took care of their families, and they had bigger families. They lived more communally, And now we have families living all over the place, less kids, less communally. So now we have this Medicaid situation where if I need to take care of my loved one back in the 60s, they need to be out of money. And so what some people did back then is say, she just needs to be out of money. So I'll just move all the money in my account. And that created by the politicians. We didn't intend for that to happen. So let's institute these look back rules. Okay, let's do the look back rules. But on the other side of the aisle, it was like, wait, this is going to be oppressive. This is going to affect this, that, and the other. So let's make exceptions to it. And that's what happened. And we have in the history of these programs, 60-year history of these programs, almost, we've had this back and forth of let's limit qualification and fraud, but let's say these situations are not gaming or fraud or unethical or whatever. And these are the rules. And when you ping pong between these rules, what happens is you get a convoluted mess of rules that require an attorney to help sort through in order to not be harmed or not see that this is unfair and not feel that way. So everything I've said so far, there is a rule backing it. And in the tax code, there's ways to protect your assets, to not pay as much taxes, and structure assets to not pay as much taxes. And in the Medicaid rules, there's ways to structure assets to not have to full pay nursing home care. Except the tax rules are mostly beneficial to people with higher net worths and higher income. And these Medicaid rules, it's the middle class that is the one that's harmed, because if you do not have savings or you have lower income, you get Medicaid. And was that the default rule or the default intent? Maybe, but with the way things planned out, it pulled in a lot of, in terms of cure cost and how inflation has occurred, it pulled a lot of more people in the world that is affected by the Medicaid rule. And then the people with higher assets, higher income, higher net worth, if you think that elder law attorneys are helping them, I'm here to tell you from dealing with thousands of families, rarely is not who we're helping and working with. The people who have higher income, have higher assets, they're wanting to do the nicest assisted livings and also in-home care, and they have enough assets and incomes to pay for that, and they don't even want to go to a nursing home. And they're making the nursing home in the assisted living, or they're making the nursing home in their own home. And a lot of times, if you heard my discussion about the patient liability rules, if the nursing home cost is $11,000 a month private pay, and somebody's making $7,000 a month in pension and Social Security, plus they have investment over here, if they're talking to me about asset protection and you're thinking about it, if I make altogether $10,000 a month for my investments and income, and you're telling me the nursing home's $11,000 to $12,000, I don't see much benefit in your service, especially if I don't see my parent lasting long. So really what elder law attorneys do is help protect assets for that middle class who want a higher quality of care and whose parents have actually deprived themselves of benefit of their own money for the desire to protect and give an inheritance to their family. So if you feel like you need some Medicaid planning and you're looking and you're evaluating, continue to watch some videos on this channel. If you have any questions, and if you're not wanting to prepare, that you need to prepare for long-term care, if you have something stopping you, please put comments and thoughts in the comments. I will do my best to respond to them, and I can make another video after that. Thank you so much for watching.